Hello, good evening, everyone. How are we doing today? Happy New Week to you all. I trust you had a great day. Compliment of the season. You are welcome to this evening broadcast. This is Dynamic Health Awareness with Juliet, and it's a place we talk about all aspects of our health. And should the case we are coming across this page for the first time, you are highly welcome. Feel free to join us and also follow us by joining this page and also sharing our video. It's a place we discuss all aspects of our health, especially women health is very, very important. So this week we are going to be looking at another series of a health discussion, and that is going to be a very special hormones in our body, and that is prolactin hormone. Is very, very important in a woman health and as well as the male health, because this hormone is play a very important role in a woman health. Is responsible for lactation, and also it also responsible for other physiological and biological processes in the body. So as we dive into this series, I want you to follow up so that you will understand everything about this hormone prolactin. You need to understand so that when need arises, you will be able to know what actually is causing it, because an imbalance in this hormone has a lot of effects on your biological processes in your body. So as you are joining, please kindly share this video. Please help me to share this video so that others can join us wherever they are. So let's quickly do this sharing. Because if you look at every aspect of our health, if I say that there is no way we can function, our body can function without hormones. So hormones are very important because they play a huge role in every aspect of our health. And this hormone, they send signal to our various organs through the bloodstream. So when anything is happening, hormone should be normally responsible, because an imbalances in this hormone will lead to various issues. So that is why we are always advised to always balance our hormone. Balancing our hormone should be on daily basis. This will help us to stay on top of our health. It is very, very important. So as I said, we are going to be looking at this hormone. In this week, we are going to focus on this prolactin hormone. We are going to look at everything that has to do with prolactin in the body, because an imbalance in this prolactin, when your body produce, let me say, little or more of this hormone, it will result to so many things in the man and also in the woman health. So it has a lot to do. So I'm going to start right away. I'm almost done with my sharing. So when you talk of this prolactin hormone, what does it really mean? You know, I said before that this prolactin hormone is an hormone that is responsible for lactation. That is, it also involves certain breast tissues development as well as milk production. So higher than normal level of this prolactin in your blood can cause certain symptoms. Symptoms like, in a woman, irregular period, infertility in both sex, and as well as erectile dysfunction on the male part. So prolactin, also known as lactotropin, is an hormone that is responsible for certain breast tissues development, and it also contributes to hundreds of other bodily tissues. So prolactin level naturally and normal is always low. Naturally are low in people that are assigned male, and that is to say, in a man, the level of this prolactin is normally low in the men, and it's also low in people assigned to women who are not lactating, that is, they are not breastfeeding and they are not pregnant. So the level of this prolactin is normally low in these categories of people, and if normally it become elevated, it can only be elevated if a woman is pregnant or a woman is breastfeeding. These are the things that can cause this prolactin hormone to be elevated above the normal level. So most of this prolactin our body uses normally comes from a gland in our body, and the name of that gland is pituitary gland. Pituitary gland is a gland that helps to produce this prolactin hormone. It makes this hormone, and it also releases the hormone by secreting it through to every cells, every organs in your body. So your pituitary gland is that very small pear-shaped gland that is located at the base of the brain, and it is just below the hypothalamus. This hypothalamus and the pituitary gland, they work hand in hand together. So this pituitary gland is also a part of the endocrine system of the human body, and it is in charge of making many different hormones. Like I said, that our body cannot function without hormones, and this pituitary gland is responsible for making many different hormones, including prolactin, dopamine, that is your brain chemical, and estrogen in both male and female, which control your prolactin production and also releases from your pituitary gland. And so your nervous system, your immune system, your uterus, and your mammary gland, they are also capable of producing these prolactin hormones. And there are so many factors that can contribute to your prolactin production. How your prolactin is made or created in these various tissues, like your uterus, your mammary gland, your immune system, your nervous system. How is this pituitary gland created? How does the creation of this pituitary gland takes place in these various tissues? So the very possible ways that your body can produce these prolactin hormones from the various tissue has to do with your nipple stimulation. When the nipples is stimulated either by touching or sucking, it stimulates the production of this prolactin hormone. Exercise is another way, another factor that can also influence the creation of this prolactin hormone. When you exercise, either over exercising can stimulate it, and also stress is another thing that can also stimulate the production of this hormone. So how does this prolactin hormone affect the body? That is to say, how does the prolactin contribute? How does it influence? How does it affect? How does if help in your body functioning. That is to say, the function of this prolactin. So remember that prolactin as an hormone contributes to hundreds of body functions, but it has a two main function in your body. It performs two main function in the body. Thank you for joining me. You are welcome. It performs two main function in the body. One of the function is that it helps in the development of the mammary gland within the breast tissues and the milk production, and it also performs the function of lactation, and breast milk production. Just like when a woman is breastfeeding, this prolactin hormone is responsible for the milk to come out from the breast. You are welcome. Thank you for joining me. So the role of prolactin in the mammary gland and development of the milk production. How does this prolactin perform this function? You know, when a woman is pregnant, during pregnancy, the hormone, which is this prolactin, another hormone, the female sex hormone, estrogen and progesterone. So both of them, they stimulate the breast tissue development and milk production. So prolactin promotes the growth of these certain types of breast tissues called the mammary alveolins, which are also a component of the mammary gland where the production of milk occurs. So prolactin, as you know, also stimulates the breast cells, the cells that are located around the breast, to create these milk components. What are these milk components? Because in a milk or in a breast milk that comes out from a woman, there are components of nutrients that are in them. They are natural components like lactose. This lactose is a natural carbohydrate, a component of milk. And also, we also have protein. Protein is also a component of milk. And we add lipid, which is a natural fat that provide energy, essential fatty acid, and cholesterol. That is why it is normally advised that women breastfeed their children, because this natural breast milk are enriched with a lot of nutrients. So when a woman is not breastfeeding the baby, that baby is going to lack a lot, because through the breast milk, it can help in brain intellectual performance of the child. It can help with vision. It can also help to strengthen the immune system of the child. So prolactin also performs a role in lactation and breastfeeding, because when a woman gives birth or when she's giving birth during delivery, the body progesterone drop down, because the progesterone hormone is high after ovulation just to sustain the pregnancy of the woman. And when the woman has given birth, this progesterone level drop. And as it drop, it begins to produce a high level of these prolactin receptors into the mammary glands and the cells that surround the breast tissues. And these prolactin receptors, they allow for milk production and secretion through the nipple of the woman, commonly known as lactation. And also, after delivery, prolactin level can never remain constantly elevated. There are things that will elevate the level of this prolactin. The level of this prolactin will begin to spike during the period of nipple stimulation. That is where the baby is sucking. It raises the level of this prolactin above the normal level. So whenever the baby is sucking, the level of this prolactin level increase, and that is how the milk will be coming out. As long as the baby maintains this sucking, this prolactin level stay elevated. So during this period, when a woman is no longer breastfeeding, this prolactin level decreases and the milk production also reduces. That is when you see that if a person does not breastfeed their baby, this prolactin level fall below the normal, fall to the normal level, just as when a woman is not pregnant. Your normal prolactin level remain like that. And after 1 to 2 weeks, you discover that the breast milk is no longer producing any milk. So the only thing that will make the milk to come out is when you force it by pressing it. That is when you see the breast milk. And it's only going to come out in small quantity. So this is the reason why you see many women, why they are not pregnant, their prolactin level is normally at the lower level. And this because the breast milk, the prolactin receptor that stimulate this breast milk have reduced to normal. So those milk that normally come out from the breast, they will cease. Since there are some women that when they give birth, you will discover that their nipple, their breast milk will not be coming out. They will now say there is no milk. There are reasons that leads to this lack of milk in the breast. This is what we call that is lower than normal level of this prolactin, because an imbalance in this prolactin level can cause a range of effects, symptoms in the body. So there are so many things that can cause the prolactin level to increase. There are so many things that can cause it to increase. There are also things that will also cause it to decrease above the normal level, because the normal level naturally in a man and in a woman is always low. The thing that will make it to become high or stimulate it is either nipple stimulation by touching or sucking, or maybe you over exercise or you are too stressed. This is why you see some women, they are not breastfeeding, they are not pregnant, but their breasts will not be bringing out milk. It is due to higher than normal level of this prolactin hormone. So the prolactin level normally rises during pregnancy and during breastfeeding. So they may also be slightly a kind of increase, a slight increase due to some situations. Like as I said, when you are experiencing excessive stress, it will lead to pain on your breast area, which will lead to a kind of milk discharge. And also exercising excessively, and sometimes the kind of meal, the kind of food you eat can also cause it. And sexual intercourse, nipple stimulation that is not related to breastfeeding, all this can also cause an increase in the your breast milk production, or increase in this prolactin hormone. Sometimes when someone has an injury that involves the chest area, it can also affect the tissues that are connected, and the prolactin receptors that are connected to the mammary gland and your blood cells. This can also lead to a kind of increase in this prolactin. Sometimes people that have epilepsy or a kind of seizures, all this can also lead to an increase in the prolactin. So this increase in this prolactin, they are usually slight. They are usually very low and temporary for a short time. So certain conditions and medication that someone can take can also cause a long-term or persistent elevation of this prolactin hormone. So I am going to talk more on these causes of this abnormal increase than the normal level of this prolactin hormone, and abnormal decrease than the normal level of this prolactin hormone, so that we'll understand better when people are having issue that has to do with breast discharge, this or that. They should know that their prolactin hormone is to be blamed. And there are so many things that can destruct with this prolactin hormone that will result to these various symptoms that they will be experiencing. So that when people are experiencing these symptoms related to lack, a decrease or increase in this prolactin hormone, you should know what to do to fix it, because the prolactin hormone can be high just for a short time, but if it is high persistently and refuse to come down and you are experiencing these symptoms, you will need to reach out to your healthcare provider so that they rule out the possible cause. In order for you to rule out the possible cause, you just have to go for a prolactin test. So a test will detect whether your level of prolactin is higher than the normal level or lower than the normal level. So this will help them to know how to fix it right. So I'm not going to take more of our time because I'm still going to talk about the major causes of all this abnormality in this prolactin hormone in the body, and most of the symptoms that you will be experiencing when your prolactin hormone is higher than normal or lower than normal. Your body is going to signal to you, because it is an hormone that regulates all body processes. So an imbalances in it definitely will give some symptoms. So thank you, my dear sister, for joining me this evening, and let us share this video and also follow me in my next broadcast. I don't know if we have a question. What about some women that does not like to breastfeed their baby? You know, like women that does not like to breastfeed their baby. If they don't breastfeed their baby, you know, because this this breast milk is supposed to run out. There must be a situation why a woman must not want to breastfeed their baby. There are some health issue that the doctor will say you cannot breastfeed your baby. But naturally, women are supposed to breastfeed their baby. So women that does not breastfeed their baby, they are going to experience some major symptoms like breast pain, because it's going to lead to a kind of engulfment of the breast. Because the milk are supposed, your body your body have already produced high level of this prolactin during pregnancy and during delivery. Because there is a high level of this prolactin in your body, your breast milk production tissues will become high. So your body will be bringing out this milk. So women that does not like to breastfeed their baby, the only thing, maybe if it's a health condition that leads to them not to be able to breastfeed their baby, they need to be pressing out that breast milk every time. They need to press it out. They need to just press it and throw it away. Since they don't want to give their baby the breast milk, maybe there are health issues that prevent them. But women that don't want their baby to suck from their breast, the best they can do is to use a feeding bottle. Press the breast milk in the feeding bottle and give it to your baby. If you don't want the baby to suck from your breast, you begin to press the milk in the feeding bottle. But do you know that breastfeeding your baby directly from your milk, from your breast, it creates a bond between you and your baby. Even while a woman is breastfeeding her baby, the baby is seeing the eyes, the heart of his or her mother. And while the mother is coming from afar, the baby will know that that is my mother. Because breastfeeding creates a bond between a mother and their child. Some of them will tell you that they do not want their breast to fall. Let me tell you, it is not breastfeeding that causes your breast to fall. No, it is not breastfeeding. Whether you breastfeed or you do not breastfeed, but the either you breastfeed, the more you reduce the risk of breast cancer. Because if you do not breastfeed, you are increasing your risk of breast cancer. So breastfeeding helps to lower a woman's risk of breast cancer. For those that say they don't want their breast to fall, it is not breastfeeding that will cause your breast to fall. Definitely, whether you breastfeed or not, your breast will definitely go down as you are aging. But do you know that if those milk are not going out of your body, they can raise your risk of breast cancer. Because those milk, they contain different substances, and your body cannot just because you have already elevated the level of this prolactin by getting pregnant and delivering. So if you have not elevated the level of this prolactin, naturally you don't get pregnant, no problem. There will be no problem with your breast. But for the fact you elevated the level by getting pregnant and giving birth, so the more your body will begin to produce this hormone. Do you know that when your body produces excess of an hormone, the excess becomes toxins. It becomes toxins to the body. So if you are not kind of flushing out those excess toxins, those excess hormone in your body, it can lead to raise your risk of various types of cancer. So the earlier the better. Is better you do not even give birth if you don't want your breast to fall. You don't want to breastfeed. It's better to save your life from the consequences. So I'm going to stop here today. If there's any other question, please still drop them on the comment section. I will still answer them. And don't forget to join me again Wednesday. We are going to continue because this is going to be a series this week. We have looked at the function of prolactin, and we are going to look at what actually causes an higher than normal level of this prolactin and lower than normal level of this prolactin. That is to say, what causes an imbalance in your prolactin hormone level. So that is where we will discuss from on Wednesday. So thank you so much for joining me, and I thank you for your question. I'm sure I explained it very well. Thank you so much. So do have a blessed day. I'll see you later. Bye.